At no point in the pandemic has it been more challenging for staff at Eisenhower Health than right now. The hospital is trying to deal with the rising surge in patients. I spoke today with Chief Medical Officer Dr. Alan Williamson on how they're managing. Dr. Williamson, as always, it's good to see you. Thanks for joining us.
Thank you for having me again, Peter.
What is the latest at Eisenhower Health?
So we are definitely seeing now our Thanksgiving surge. We're definitely into the thick of that. We have about 132 patients in the hospital today with COVID. Remembering that the worst of the surge that we had in the summer was only about 85 to 90 patients. So we're already well beyond that. And we forecast that we're still probably a couple of weeks away from the actual peak from post-Thanksgiving.
If you could put this in perspective for us, Dr. Williamson, is this the worst that it's ever been during the pandemic?
Oh, absolutely. Absolutely, without question. The rate of rise that we saw in this surge, definitely much steeper than what we saw in the Memorial Day, post-Memorial Day surge. So we are very concerned about how high this is going to take us. And then equally importantly, very concerned about the fact that Christmas holidays then fall immediately on the tail end of that surge. So we will barely be emerging from the post-Thanksgiving surge and heading right back into a post-Christmas holiday surge.
Have you had to make any changes to the hospital surge plan?
Our surge plan changes pretty regularly as we keep adapting and trying to model exactly what we have seen. So we've had actually several meetings already this morning looking at some modeling based on what did we see happen in Memorial Day or after Memorial Day in reality, as opposed to theoretical planning based on what we think might occur. So we've created a new model based on what we actually saw in terms of the timing of when the cases start to go up, when do they peak, when do they start to return back to normal. And the numbers are quite concerning, obviously. So we are working with those numbers now to really understand how will we be able to meet those requirements. We have the facilities. I'm not overly worried about actual bed capacity per se, but as we've said over and over again in all the other hospitals, staffing is really the critical issue. How are we going to be able to staff those beds effectively so that we can care for our patients?
Yeah, I know we've talked about staffing before, so then let me ask you, what do you do in this situation where you do need more staff? Is the county or the state helping in any way, or where are you getting these extra staff members?
So yeah, there are many avenues that we're really pursuing to try to understand, where can we get additional staff in order to help both internally and externally. As we've talked about before, the concern is really looking for external sources in any enormous numbers is probably not realistic because the entire country is wrestling with the same problem largely simultaneously. So we have already reached out to the county and to the state for additional outside resources. We've actually received a couple of nurses from the state pool, but still a very small number. But in reality, I think we're going to have to solve this largely on our own. We're looking at potentially, obviously, having to modify the way that we are seeing patients in the clinic. We know that we've used telemedicine in the past fairly effectively to cut down on the number of patients that were coming in to see the physicians. And we can't do away with in-person visits completely, but perhaps we can adjust our schedules around so that we're seeing on certain days only seeing video visits and we can free up nursing staff potentially out of the clinics to come help back up our nurses in the hospital.
What's the latest with elective procedures at the hospital? And are you still encouraging patients to come into the emergency room who don't have coronavirus?
Yeah, let me address the latter question first, because that's really critical. At this point, we still need to remember that there are many patients that have acute medical problems that need to be taken care of. We have heart attacks, we have strokes, we have other acute medical illnesses and surgical illnesses that need to be addressed. And we are doing everything we possibly can, and we are still very confident that we still have a safe environment and that we can care for those people safely and they are independent of our concerns right now with COVID. We understand that we still have to take care of those patients. That's part of the surge plan to understand, okay, we still have 50 to 100 patients that are non-COVID that still need to be managed appropriately and safely, and we are very confident we can keep doing that. So please don't put off, if you're having chest pain, if you're having symptoms of a stroke, if you're having major medical illnesses, please don't put off coming to the emergency department if need be, or at least contacting your physician, getting medical advice, because it is safe to come to the hospital if you need to come here.
And elective procedures?
In terms of the surgical schedule, we are definitely looking at that right now. We are working very closely with our surgeons and other proceduralists, including cardiology, gastroenterology, and so on, and focusing at this point primarily on understanding the impact on inpatient care, meaning patients that are going to need intensive care unit beds or hospital beds for their recovery. Can we safely postpone their surgery, or at least can we be very cognizant of how we spread those surgeries out over the course of a week, over the course of a month, so that we don't overwhelm the system. We do expect at some point, it is quite likely that we will have to stop elective surgery completely, but we're trying to do it in a logical, stepwise fashion.
How are vaccinations going so far at the hospital with healthcare workers?
So obviously, we're very excited to see vaccinations rolling out, and when it finally is rolled out to the community is when, of course, it will finally have a major impact on our numbers. Right now, it's about being sure that we protect the healthcare staff so that they're there for you if you become ill and need to come to the hospital to be cared for. It's going pretty well right now. It is quite a logistical issue. I think this is an interesting run-up to what's going to happen as we start to expand into the community and know that we're going to be looking at, as a nation, trying to vaccinate 300 million people. How is that going to happen? We're also cognizant of the fact that 5 to perhaps 10% of people do get a significant reaction where for a day or two they have fever, chills, body aches, and so on. So timing this around their work schedule, because we can't afford to lose 5 to 10% of our staff on any given day. So we have to pace how we're doing the vaccinations to be sure that we don't end up all of a sudden with a lot of people calling off sick as a result of the vaccine.
As you know, Dr. Williamson, we're encouraging our viewers to send in vaccine-related questions to coronavirus@kesq.com. And one of our viewers would like to know, because both Pfizer and Moderna require 2 doses, can you get the first dose from one maker and then the second dose from the other?
Yeah, at this point, the recommendation would be to continue with the same provider, because the vaccines are different. Even though they are both addressing the same virus, they are different in terms of how they work. From a clinical standpoint, as a patient, as a recipient of the vaccine, one should really worry about it.
All right. Dr. Williamson, we appreciate your time. Thank you so much for joining us.
Peter, thank you.